Okay, I think I lost you, Kelvin, but thank you. Joshua, I saw you tried to put on your video. Are you able to unmute and say hi to us?
Yes, morning. Morning, good morning.
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 Can you hear me? Okay, morning everyone. My name is Joshua Muriungi. I'm a pharmaceutical technologist working at Meru Teaching and Referral Hospital, Oncology Department.
Okay, thank you. We will move on to the last batch, which is we will do Monica, Perpetua, and then Stephen.
Morning, everybody. My name is Monica Ramogo. I'm a clinical officer oncology, working at Kehpca Teaching and Referral Hospital.
Okay, thank you. Perpetua, Stephen, and then Mumbi. Over to you. Perpetua, if you can hear us kindly. Or Stephen. Stephen, are you in a position to speak?
Hello, good morning.
Morning.
Yes, I'm Stephen Matumbai, working at Mwai Kibaki Othaya Hospital, which is an annex of Kenyatta National Hospital. I'm a clinical officer oncology.
Okay, thank you. So, Mumbi, are you in a position to hear us? And then I saw Faith Gitari join us. So the two, and then we can move on.
Good morning, all.
Morning, Mumbi.
Good morning. Yes, my name is Mumbi Njunge. I'm a clinical oncology pharmacist working at Taita Taveta County in a hospital called Moi County Referral Hospital. Thank you.
Thank you. Over to Faith. Perpetua, if you can hear us, we are waiting for you as well. Faith.
Good morning. Good morning. My name is Faith.
Yes.
Yes, my name is Faith. I am happy to join this forum. I am a nursing officer at Kenyatta University Teaching and Referral Hospital. Thank you.
Okay, thank you very much, Faith. Perpetua, if you're able, you will type on the group. Kindly let us know where you work and your profession. We will move on to introducing our other team, which I would first wish to call upon one of the facilitators, who is Dr. Asaf Kenyanjui, to say hi to us. And if you have something else to add, Daktari, the forum is yours. Thank you.
Thank you, Emily. Good morning, everyone. My name is Dr. Asaf Kenyanjui, palliative care practitioner. I also serve at Kehpca as a board member. Thank you all for having interest to join this training. I hope you'll be able to learn as much as possible so that you can be able to improve the quality of life of the patients you serve. And we are here to support you through this journey. So feel free to interact with us through the forum that will be created so that we're able to give you as much support and insight as possible. Asante.
Asante sana, Daktari. We will move on to the NCCP team. I will call upon Dr. Joy Frida to take over. Kindly introduce yourself and your team. I know we will have a session for you a bit later, but the forum is yours, Daktari. Thank you.
Hi, good morning. My name is Dr. Jeffrida Chepchumba. I work with the Ministry of Health under the National Cancer Control Program. I'm in charge of the third pillar, which is treatment, palliative care, and survivorship. And we're honored to be part of this training. I think the head of the program, Dr. Nyangasi, should be in the call. I'd invite her to introduce herself.
Morning, everyone. My name is Dr. Mary Nyangasi. I serve as the head of the National Cancer Control Program. I want to take this opportunity to thank Kehpca and also everyone who has registered for this training, and looking forward to the meeting. Thank you.
Thank you very much, Daktari. We will thank you for logging in this early morning, and that is all from me. And we will move on to the next session where we welcome our Executive Director at Kehpca, Makilin Atieno. Thank you.
Thank you so much, Emily, for taking the first session and for the introduction. And thank you for all of us for being part of this session, the students, the facilitators, the Kehpca team, as well as the this training, and to commend you for making time and making a decision to participate in this palliative care training. We know as cancer people who are specialists in cancer area are very busy, and there's quite a lot of work to participate. There are many patients just taking time to have this meeting, and even in moving on, participate in the course shows that dedication on your part. Kehpca is really passionate about improving the quality of life of people with palliative care needs, people with life-threatening conditions within a wide spectrum, and people with cancer form a big percentage of people who need palliative care. I know the post-COVID area, there's been quite an explosion of courses, webinars, and knowledge is really available out there. And we may enroll to different courses for different reasons, but I can assure you that enrolling in palliative care course is a very good decision, because this is knowledge that you lose anywhere. As long as you're a healthcare professional, as long as you aim at improving the quality of life of people, making them feel better, either physically, spiritually, psychologically, and socially, whichever cadre you are in, you will find this course very useful, and you'll be able to use it in whatever role you are in. So it's a course that will not go to waste. I can assure you that. Once you are going through it and you apply, I believe that you'll have better outcomes for the patients that you see. Not only for the patients, but even for yourselves or ourselves, because once you improve the quality of life of someone and they feel better, you also feel like you have achieved. So I welcome you to this course. We have a very able team, the facilitators, the team, and the Ministry of Health, who we're really thankful for their support and taking lead in this. And we believe that at the end of this course, when we meet again, we'll be having different stories and different stories, better stories. And we believe that when you go back, we're going to use that knowledge to change something small, something big, for the betterment of our patients, for the betterment of the country as a whole. So, karibuni sana, and wish you all the best. Thank you.
Thank you very much, Makilin. I hope wherever you are, you're clapping as the facilitators speak. So thank you, Maki, for that. We have clapped for you. Yes, I can see virtual claps. Thank you for that. And now I will welcome Dr. Mary Nyangasi to make her remarks. Thank you.
Okay, thank you so much once more for this opportunity. Indeed, on behalf of the National Cancer Control Program, we want to appreciate each and every one of you. We know that working in the space that you are, you have many other duties and obligations, but you decided to enroll in this course so that you can learn more about palliative care. For us, you know, palliative care is a very important approach in improving the quality of life of cancer patients, and of course, also patients with other chronic illnesses. We believe that with proper palliative care, which should start, I'm sure you learn more, but we believe that with proper palliative care provided for our cancer patients, we will be able to prevent and relieve a lot of suffering. We'll be able to identify and manage pain or other symptoms that they come with, including even their families, so that they can have a better quality of life. So we know that there are many gaps in terms of palliative care provision, and initiatives like this, where we are able to train you, will go a long way to make sure that we have the knowledge, the skills that we need so that we can be able to provide better services. So this capacity building initiative is very much in tandem with our new strategic plan. As you may be aware, we now are implementing a new cancer control strategy, 2023 to 2027, which we recently launched. And one of the key pillars, which Dr. Jeffrida leads, is actually on treatment, palliative care, and survivorship. And in that pillar, capacity building has been highlighted as a very important aspect that we need to move forward. And my prayer is that at the end of this training, you will be able also to have sessions in your various facilities with other colleagues so they learn from you as well. So my encouragement, after this, you will be empowered. Please don't put all this information to yourself. Take an opportunity to disseminate it to your colleague, tell someone, tell another and another. So I think with those few remarks, I just want to say thank you. And as I conclude, let us not forget children, even as we are providing our palliative care services. Thank you so much, and God bless you all. I look forward to a successful training. Thank you.
Oh, thank you very much, Dr. Nyangasi. Yes, more virtual claps are coming. Thank you for that. We will move on to, we are 9 minutes late into our next session, and I will invite Dr. Esther Munda to take over. Thank you.
Thank you. Thank you so much, Emily, and thank you, team, for making time this morning. Apologies for beginning late. And I know most of you have had an experience, maybe your first experience using Teams. We hope to have more engagements with you using this online platform. But in case of difficulties, just reach out and we'll be able to assist. So thank you for trying and navigating and making it here. Some of your colleagues have given their apologies. Some, I think the app has refused to work, but most of you are here. So I'd welcome you so much to this course. We are looking at scaling up palliative care education among health professionals working within cancer centers. And from the remarks made by my predecessors, Maculine and Dr. Nyangasi, you have an idea of why we are doing this palliative care training and targeting you. We have about 29 or 30 people who have registered for this course, and you will know each other, the rest of those who are not here, in the course of our interactions, hopefully through our WhatsApp group. And I hope we are all open to that. So I'll move forward and yeah, I hope you can see that. I'll move forward and just introduce who Kehpca is and the course that you're about to do. And for those who've joined in later, if you didn't introduce yourself, you could just type on the chat your name, your profession, and then your facility or the facility you work in. And also if you're not able to introduce yourself verbally. So Kehpca stands for Kenya Hospices and Palliative Care Association, and it provides support in terms of palliative care standardization and quality of care for all palliative care providers across the country. So our vision is quality palliative care for all in Kenya. And our mission is to promote and support accessible, acceptable, and affordable quality palliative care. And we focus on persons living with palliative care needs. That's the term we use. And not you will not really refer to our patients as the cancer patient or the person with the stroke. That's not the term we use, but we refer to them as a person living with palliative care needs. I remember in palliative care, we personalize care, and we focus on the whole person as well as the family. And you learn more as we go through the session. So Kehpca is based in Nairobi, and we work with different stakeholders, including stakeholders and partners, including the palliative care institutions, the Ministry of Health, the county governments, mission and private facilities, as well as county facilities. And most of you are actually working within these facilities. So if you hear the term Kehpca, you'll just remember it's the umbrella organization representing palliative care providers. Kehpca's strategic pillars are 4. We focus on member revitalization, palliative care advancement, strengthening Kehpca as an organization. And our pillar 2 is actually information, education, and awareness. And that's the reason we are keen on advancing palliative care among different health professionals, and the reason why we are having this session with you. Our training is important because it will help us harmonize palliative care service provision in Kenya. And as professionals, you've introduced yourself. It will be good to find out what role you play in your capacity as a health professional in advocating for palliative care services for patients and families within your county or within your facility. So by the end of this training, we expect you to be the palliative care champions within your cancer centers. And even if you move to another facility, these services are still important in those in the areas that you move to. And Dr. Nyangasi has reminded us to share this information with others. And that is still a recommendation from our end, because learning doesn't stop. And the more you share, the more you learn. So our goal is to equip you with appropriate knowledge, skills, and attitudes on palliative care to enable you provide quality, holistic services to patients and families. We are focusing on cancer centers, but remember, palliative care is broader, as Maculine has mentioned. It's broader than cancer. There are many other life-threatening illnesses that you will come across when you're doing your course, and it will be good to find out from you what other conditions. You could also put it on the chat. What other conditions do you think would benefit from palliative care services? So if you could type in the chat, we'll go over that bit in a short while. So what other conditions do you think would benefit from palliative care? Please type on the chat. So the training is divided into 7 modules. And the first module addresses aspects of palliative care. So it's an introduction to what palliative care is. Number 2 looks at clinical assessment of palliative care, so the symptoms and support of patients. Number 3, we look at nutrition. And 4, we look at psychosocial aspects of palliative care. 5, we look at children, that's pediatric palliative care. 6, we look at system strengthening. And the last very important session is practicum, where you will be expected to undertake some practical sessions within a palliative care center. So what is required of you? We also sent your terms of reference on email. I hope you all received that. So it's self-paced learning. You'll need to undertake independent studies, and there are some group assignments assigned to you that you'll also need to respond to. That is on the online platform. You should also be open to mentorship and supporting palliative care. So we will have a palliative care WhatsApp group for all of us where we'll be interacting, and we hope that you will also be responsive and keep the communication lines open. The course will take us approximately 2 months. So maybe 5 weeks of the online reading, and I know some of you can even finish that faster. Then unit close to you, and that bit you'll communicate with us so that we have that planning done in advance, where you'd be doing the palliative care placement. So we'll also be giving you a list of accredited facilities for placement, so that wherever you're going, we are assured you're receiving quality mentorship support. Then at the end of it all, we would be giving you a certificate. This course is the introductory course to palliative care. It's the basic training you're able to achieve, and there are many other trainings you could undertake in the future, including the diploma, the degree, the master's, PhD, or whichever level you want to get to. Kehpca will support you with data for you to access the course, and that will be shared with you, I think, in the course of towards the end of the month, but we will communicate with you. But the main thing is for you to show your commitment to the course. We had many applicants, but we only had slots for 30 of you, and we hope to get more of your colleagues also taking up these courses, so that we have that information shared across counties in Kenya. So re-emphasizing, once we complete this, we recommend that you shall be committed to grow and strengthen palliative care initiatives at your facility. And I think, was it at Demba, the first, whoever joined the meeting first, this was something that came out in his reason for joining the training, and we pray that it also applies to the rest of you. Yeah, so let me see if you have any feedback. I see you've mentioned that Alzheimer's disease also benefits from palliative care. I don't know if there's anything you'd like to add. So my question was, what other conditions would benefit from palliative care? Yeah, I think I'll end there, and then we move to the next bit of the session, where we would be taking you through enrolling into the course, and I'll hand this to Paul. But if you have any questions, you could feel free to raise up your hand or just write it in the chat. And as Paul prepares to speak, welcome Dr. Caroline from Embu Level 5, as well as Dr. Nafula, who is our palliative care physician and part of the faculty working at Kenyatta National Hospital. Mombi, thanks for your feedback. You say SLE also benefits from palliative care. Thank you for your attention.
I'll hand over to Paul.
Good morning once again, and thank you for deciding to be a part of this program. I am Paul, as earlier introduced. I handle IT at Kehpca. I'll be taking you through how to register for the course, and it all begins at the point of creating an account on our e-learning platform. So the first step is the website that you see there on the screen. I don't know if you can be able to see my screen. Kehpca.org. Once you go there, I don't know if maybe some of you have already visited the website. You will find the homepage looking something like this. And at the top there is where the arrow is pointing. You can see that there is the e-learning link. There's a blue top bar there. So you click on the e-learning link, and then it will navigate you to this page. Now, this is our e-learning platform, and this is the landing page. So if you take a look at the top right, you can see login. And that's where you click, and you will be navigated to this new page here. So since you don't have your login credentials yet, the next step is definitely to register, and you navigate down below the login button. Is this your first time here? And then you create a new account. You click that button right there. You will be prompted to fill in your information. The regular one you normally fill in signing up for any other online account. So you will see your username, password, email, and the likes all the way down to a section where you will find where you will confirm your details and submit. So once you submit, we will get your information on this side. And from there, you will be able to be enrolled into the course. We'll do that from the back-end side of it. And we will communicate to you on that so that you can be aware of it, and you'll be able to have access to the course. So this will be the landing page once you're in, and you'll be able to be, we'll communicate to you on how to maneuver around the platform. Okay. So you'll see modules and things like this. This will be kind of like what you will be going through during the self-paced program. I think any further information we shall communicate later, but on the registration, that is about it. Thank you, Esther.
Thank you, Paul. And I know some of you have already created accounts. If you've had difficulties, Paul and the team will be here to assist you. So finally, we would like to invite you, next slide, invite you to our palliative care conference that will be happening in November 15th to 17th. I hope to see most of you there. I've seen some of your names in the registration, but we are looking forward to have a time of interaction and learning from each other as health professionals. The dates are 15th to 17th of November. And if you're interested, reach out. We'll be able to share more information. But if you go to our website, the conference website is also available for you to interact with. Thank you so much. Mombi, I see your chat. You've said you've not yet created an account. So even as we finish this, your call to action now is to make sure we have created an account. Once it's activated, you'll be able to log in and go through the study materials, but we'll be following up so that no one is lagging behind, because we have a short time to finish all the modules. I'll stop there and open this up for any questions or concerns that might be arising. Thank you all. I'll hand over to David to take us through the last session.
Okay, thank you, Dr. Mwinga and the teams here. We are, like I said, excited that we're having this opportunity. Remember, we have 2 months to complete the course. At times it looks like a long period, but when you start to get into the different modules, you realize time moves very fast. And so I want to encourage everyone to be prompt and sort of start immediately with adult learning and with the many tasks that we have. Sometimes it gets us, finding ourselves running the last minute, and the learning objectives will be hurried. But if you're intentional enough and at least you set some specific timing and you're disciplined enough to go through it, you will find it very helpful. The cohorts that have done this course before, we have champions who have really given us their, I call them testimonies or their experiences, and they have acknowledged that it's a worth course that influences their knowledge, skill, and attitudes as well. So we hope that this will, in fact, make your work in the different places much better. So thank you, and I want to open up if anybody has a comment or question, just unmute and speak. Any clarification, comment, or any concerns? Esther, you can stop sharing the screen so that I see everybody.
David, we have a few questions on the comment section. Maybe I can read them, you can guide us. Joshua asks, can one download the reading materials to read well offline? And Omwamba asks, when will the accounts be activated?
Okay. The downloading bit, what happens is it's an online course, and so you can only read the content online. It's not, most of the content is not downloadable, but there are few things that would be downloaded, but majority of the course would not be downloadable. Omwamba, when will the accounts be activated? It will be done immediately we commence. So by the end of the day or tomorrow, you'll be able to, once you register, you'll be able to access the content and you'll be able to start your studies. What time will the classes be? Remember, I said it's self-based learning. And so you learn at your own time, at your own convenience. We will have, Esther will guide, but this is the Inception meeting when we are all together, but you'll be learning at your own pace. You'll be given module leaders. We have Dr. Nafula here. She'll be taking us through one of the modules. We have Dr. Kinyanjui. He'll be taking us through modules, and there are pre-test. Be required to answer some of the questions that will be sent to you, and you can reach out majorly to the course leaders, the module leaders, and also Kehpca if you feel, so that you're well guided in case you're stuck. So there will not be uniform class times. It will be based on you, but I know towards the end we'll have another forum like this where some reviews will be done. I hope I'm clear. I got lost at creating the account. Faith, Paul, are you able to clarify that bit?
Yes, I think I can go over that again. Just briefly, just give me a second.
As Paul gets that slide, what you do, you just go to the Kehpca website, and this information will be also shared once we form the group, including the simple way of how to register, how to sign in. There will be some documents shared through the WhatsApp group and possibly through your email in case you need that. Yes, Paul.
I don't know if you can see my screen.
Yes.
Yes, so it's quite easy. Once you just navigate to the website, there'll be a link at the top there. Once you click that link, it will now navigate you to the e-learning platform where you can log in. You click the login button at the top right. But since you've not created your account yet, there'll be a button there at the bottom that will allow you to create your account. And once you click on it, you will be required to fill in your details there for registration. So once you do that registration and submit, you're through with the first step of registration. And from our side now, we'll be able to give you access to the course.
Thank you, Paul. And since we'll be monitoring from the back end, we'll be giving periodic kind of just hits to know where we are at, to tell the people that are ahead, the ones who are lagging behind, not really to shame, but just to ensure that we're moving all as a cohort. So we expect, since there are 6 learning modules, that within probably the first month, at least you've done 4 or not less than 4. And so we'll be giving some a bit of periodic hits just to also to encourage those who are doing very well, but we hope we all be doing very well. That's our expectation. Any
We
other
will share
questions?
these slides as well. Sorry, David.
Yes.
We will share these slides as well on the WhatsApp to assist you with the registration process, and we'll be there for any assistance.
Great. Any other question or comment?
Just to add, I know there was a question on the offline reading, so we'll be sharing with you a data bundle so that you don't have an excuse and say you are not able to log in. Thank you.
Thank you, Esther, for that clarification. At least I'll be happy to hear a comment from one of the trainees. Anyone who would want to unmute and just give us some feedback? Was it clear? And if you do not have any question,
Okay, this is Debra from Lonkika. I'm trying to inquire if there's a bachelor's degree in palliative care being offered in Kenya, or is it the diploma only?
Thank you, Deborah. I'll clarify that shortly. Any other question or comment? Okay, so in Kenya, we do not, sorry, go ahead.
I was asking, after I've submitted my information, how do I know that the registration has gone through?
Thank you, Josephine. Any other? Okay. So to answer the first question around whether we have a degree course in Kenya, the answer is no. We do not have a degree course in Kenya yet, but Kenya has two facilities that provide the higher diploma in palliative care course. MTC Nairobi, majorly for nurses, and then we have the Nairobi Hospice in conjunction with the Oxford Brookes University in UK, which provides the higher diploma course for multi-professionals. So any healthcare worker would undertake that course. They are online courses. For the degree, the nearest university that offers it is in Uganda, University of Makerere, and it's a distance learning course. The other university that offers that degree is Kehpca, South Africa. Then the other universities would be out of the region, and we can provide that detail if you're interested. We've been trying to work with universities in Kenya to have at least a host, and that discussion is still ongoing. To answer Josephine, how you'll know whether you, once you register and you submit your contacts, or else the registration details, there will be an email sent to you, and then you'll be accepted. Then there'll be a notification through your email, and that happens just like very quickly. It's not a big, tedious process. And in the event you're stuck, we'll be there to assist. Great. So I see no other interaction or clarification. Thank you, Esther, for this opportunity. And it is saying, I've created an account, but I can't access the reading. Yes, you can't access right away because we have to allow you to enable you access the materials. So after this meeting, we'll be doing that sequentially. But thanks for registering. It's a controlled course, so we have to be sure anybody registering as access, so that it's just not anybody, because those who are interested but not part of this cohort are charged. So for you, there is a partner who has paid for you to enable you access this course. And that is one of the reasons as to why I would wish that you take it very seriously, because again, there is a cost to this course. Those who want to do it individually are charged. So that's why we control it that way. It's not open access.
David, I think there was a question on how will someone be able to know if they've registered successfully? And you should be able to receive an email on successful registration. And then just as Daisy has said, once your account is created, that's when you can be able to activate it, so you can be able to access the content.
Sure. Okay. So thank you, and we'll request that the WhatsApp group that will be formed remains strictly matters palliative care and matters the course. We do not want people forwarding non relevant kind of information. And we are usually a very, it's not a threat, but we are usually very serious. So if somebody starts to forward malicious stuff, we just remove them, and we don't like that. So let's just keep the ethics of the group, and we learn together. Over to you, Emily. Thank you, Tim, and looking forward to further interactions.
Okay, thank you, David. We can virtually clap for David and for Dr. Esther. So we have come to the end of our meeting today. As Esther said, we'll be sending you bundles facilitation within the week or early next week. We wish you the very best as you learn. We will create our WhatsApp group and then we will discuss more, but kindly feel free to talk to us. We will have our contacts as well as our emails. So kindly feel free to talk to us. Thank you very much and have a great day ahead. You are free to leave. Thank you.
Thank you all and have a great day. And thank you, facilitators. Thank you, NCCP, for joining. Thank you, Maculine. And yeah, I look forward to further interactions. Bye.
Bye, Dr. Esther. Thank you.
Hello. Good morning.